Hey guys, this is Catherine Bradford. I'm doing my transcultural nursing presentation on the Amish and how we can provide culturally sensitive care to this group of people. To start off, with increasing immigration and cultural diversity on a drastic rise in this country, nurses have to be able to provide culturally sensitive care to a number of different groups of people, and all of those people have different beliefs, and they all have to be respected in order to provide equal care. As nurses, we need a base understanding of the groups that we may come into contact with, and even if we don't have that understanding, we need to be constantly seeking that understanding in order to provide the best care that we can. One cultural group that's prevalent in the northeastern states of our country is the Amish. So this presentation is going to examine the Amish culture and their beliefs that surround healthcare and some things that might affect certain age groups and how we provide care to those age groups. The best way to improve cultural sensitivity and to reduce any personal biases is to seek education and understanding about different individuals and their beliefs. So just some facts about the Amish. The term Amish refers to a group of people who live apart from the modern world. They're descendants of the Anabaptists that emerged during the Protestant Reformation. These people dress differently. They have a different language that is kind of a blend between German and Dutch, and they use modern technology really selectively. They stress being separate from the dominant culture. There's an estimated 160,000 members of the Amish population in the United States and in parts of Canada. This is just a picture of some Amish girls playing a game that appears to be similar to baseball. It's just a typical way that they would dress. This is a picture of a horse-drawn buggy. This is their mode of transportation because by not recognizing modern technology, they don't get around by motor vehicles. According to our textbook, Andrews and Boyle, the beliefs of the Amish are based on two scripture passages. The first one is from Romans. It says, "Be not conformed to this world, but be ye transformed by the renewing of your mind." And the second one is from 2 Corinthians. "Be ye not unequally yoked together with unbelievers, for what fellowship hath righteousness with unrighteousness, and what communion hath light with darkness?" So those are the two passages that kind of guide the way that the Amish culture lives their lives and the way that they feel about the world and everything else. There are two unique tenets of the Amish culture. The first one is Ordung. That's the way that they are governed. It's based on religious passages, but basically it's their rules of how they're supposed to conduct themselves. And then the Maidung is the practice of shunning the members of the culture that don't adhere to the rules of practice. And it keeps order in the community, maintains separation from the outside world. Minor violations are discussed between church officials and handled quietly within families. Major violations could result in more public hearings among church members, or the person that committed the infraction could just be immediately shunned from the community and not allowed back in. To the Amish, the definition of illness is considered being unable to perform your daily chores. So health would be the opposite, being able to perform daily chores and operations and contribute to the family practices. Some beliefs related to health care among the Amish. Access to transportation is a huge barrier in their health care. They don't embrace motor vehicles and they live in separate communities. So they're long distances away and they don't have any way to get to modern hospitals and facilities. Narcotic drug use is not allowed in this culture, so pain control would be an issue. There aren't any restrictions against the administration of blood products and blood or vaccinations. The Amish don't identify with modern technology, so many of the medicinal advances that are available today are probably not recognized by the culture. They do use a lot of folk, herbal, and homeopathic medicine in combination with the Western biomedicine. In care of childbearing women and their families, the sole purpose of marriage in the Amish culture is procreation. So families are usually really large in size, and children are expected to help with the daily operation of the household and assist their family in earning money once they reach a certain age. Things such as abortion, in vitro fertilization, fertility treatments, all of those are not allowed and not recognized by the culture. In situations of cancer or severe illness, sterilization may be authorized, but that's after consultation with church leaders and family members. So everything is decided as a group, it seems. Some things that may affect care of children from age 0 to 17. The Amish believe in chastity before marriage, so no sexual intercourse before marriage. Couples who are considering marriage may do something called bundling, or they can lay in bed beside each other but have no sexual contact, and they have to be fully clothed. Alcohol and tobacco use are strictly forbidden, so activities of a lot of teenagers in modern cultures involve alcohol and tobacco use, but in the Amish culture, they're strictly forbidden. At the age of 16, Amish teenagers are encouraged to explore the modern world in something that's called rumspringa. It means to run around. So they change the way that they dress, they use modern technology such as cell phones, and they stop adhering to their social norms for a certain period of time. At the end of that period of time, they can choose to return to the culture and live life as Amish, or they can leave and then try and assimilate into modern society. Some things that may affect the care of adults age 18 to 64. After age 18, the Amish marry and then procreate, as is the purpose of marriage in their culture. They live in close-knit communities. Many use agriculture as their source of income, as well as create things like furniture, but they do all of this without the use of electric or motorized tools. They do pay taxes, but they don't collect Social Security. It's viewed as being of the modern world and a form of government insurance. In care of adults age 65 and up, start looking towards death and dying in this age group. The Amish consult with the church leaders in the case of any euthanasia or a patient's right to die. After death, autopsy is seldom performed, but it is acceptable in the culture, and the Amish usually oppose the donation of any organs for research. They want their bodies to be buried intact. The community bands together to care for the sick and their family once the person is sick. So they take care of their own elderly population. Some things to consider when providing culturally sensitive care to this population of people. The nurse has to consider their dress preference, their preference for separation from modern advances, any language barriers that may be present, and financial barriers. The nurse must also respect the inability to use narcotic pain medicine and suggest other ways for pain control. And, because the Amish culture is a more traditional culture, the preference of the patient in regards to having a caregiver of an opposite sex must also be addressed and, if possible, adhered to. The nurse must acknowledge the patient's need for a lot of people around them, such as church officials and family members, and the involvement that those groups of people have in medical decision making. So to conclude, it is unlikely that an Amish patient would accept modern technology that's involved in being cared for in a hospital, but we still, as nurses, have to be aware of cultural differences, especially with groups that are so drastically different, such as the Amish. Cultures progress as generations age, and there may emerge a new sect of Amish that accept some medical advances and seek care in a hospital setting. The Amish are really an interesting culture, and with them not recognizing modern advances and choosing to stay separated from the world, sometimes it's difficult to know about their culture and be educated in their culture. But it's our responsibility as nurses to be aware of those differences and provide care that respects those aspects of their culture. And then these are the references that I used. I used our book and a couple of websites, and then the photos came from a website from Lancaster, Pennsylvania, as well as one from CBS News. All right, thanks guys.